Welcome to the Insights Research podcast, where we explore the journeys and motivations of clinical academics, researchers, and healthcare professionals, shaping the future of healthcare and science. My name is JoJo Chukwuemeke. You can call me JoJo, and will be our host for today. In today's episode, we'll dive into the exciting world of clinical research. What does it mean to be a clinical academic or clinical researcher? How do they bridge the gap between research and practice? And what inspires them to take on this unique role? Joining us today is...
My name's Anthony Gilbert. I'm a postdoctoral research physio at the Royal National Orthopaedic Hospital. I'm working out of the Enfield Musculoskeletal Hub.
Thank you so much, Anthony, for joining us today. For our listeners who might be new to this, how would you define a clinical academic or clinical researcher? I remember when I first started, I really didn't know what it is. I thought it was probably people that teach lecturers, but then I got to learn about it and I had very insightful information. Can you summarize the definition for us?
I probably can't summarise it succinctly because I think people see it very differently depending on where they are. But my role, I'm a full-time researcher based in clinical practice. And my role is to lead a programme of research around the clinical practice that my team operate in. But that's sort of my role within the team. So I think it bridges the gap between research and clinical practice in many ways. And I think it sort of, as you generate research or generate knowledge from clinical practice and then you reinvest that knowledge back into it. So I think it's an evolving process. But I'm there to facilitate evidence-based practice within where I work.
Oh, so did you go into practice before coming into research?
Yeah, so I was full-time clinical for about 5 years, and then I took a year out and did a master's in research, and then I was in a split clinical research post here at the Royal National Orthopaedic Hospital for a few years. Then I did my PhD. Then after my PhD, I'm full-time research, but I'm quite unique in that I'm employed by the NHS, not an academic institution. So I'm one of the team here that sort of facilitate research within clinical practice.
Lovely. So what does a typical day look for someone in this role?
Every day is different. Today, for instance, myself and a clinical colleague went to a drug and alcohol addiction centre in Enfield. The clinical pathway that I'm working on at the moment is looking to support people to access musculoskeletal care because we recognise that they're not always able to access. But today I went and met with the team in this drug and alcohol centre to talk about how we're going to build a new pathway that supports those patients with addiction problems with musculoskeletal issues. And I was talking about how we would set it up and how we'd measure its effectiveness, and also sharing the insights that we've got from our clinical pathway. So quite often I'll be going out doing site visits in the community and then feeding back into the clinical team. Tomorrow I'm having a paper writing day, so I've got to finish off a paper. Thursday I've got more site visits and I'm interviewing patients for another project. So every day is different, which is what I love about it. It is truly different and very exciting. And yeah, take each day as it comes, but it's really fun and lots of different things going on.
Oh, that sounds like a lot of work.
Yeah, it is. But what I would say is it's really enjoyable and it doesn't actually feel like work. And I think when you're in a job or in a role where you are just genuinely excited by what you're doing, and it is super rewarding as well, it just doesn't feel like work.
Oh, speaking passion.
Well, yeah, I suppose it is. I mean, I suppose going from clinical practice, which I really enjoyed, it took a lot to sort of tear me away from that. So I've found the niche in the area that I suppose I am quite passionate about what I do. But working with a clinical team and working with a group of sort of amazing people as part of that, I've got my own sort of little unique role, and I contribute, a fair bit to the overall team. But it feels it's nice to be part of a wider group.
Wow, that's lovely. Can you tell me the difference between clinical work and research work?
Yeah, so, I think if I reflect on my role as a clinician, it was a lot more structured. So, I would be in at a certain time, we'd have a sort of team meeting, we'd go out onto the wards or I'd see patients in outpatients. Whereas every day now as a researcher is completely different, as I was trying to describe before. The biggest thing about being a clinician that I enjoyed was being able to help people, and I think in the first few years when I became more of a researcher and less of a clinician, I sort of really missed that day-to-day patient contact. And I think what I valued as a healthcare professional was being able to make a difference to patients' lives. So a patient coming in, I'd see them over a few days or a few weeks, depending on what service I was in. I always found it really rewarding when I was able to contribute towards their overall journey of getting better. And I think now where I am with my role as a clinician and sort of helping to shape the clinical pathways, I'm able to help patients on a not necessarily grander scale as in like a more important, but I'm able to still influence patients' lives, but on more of like a macro level rather than like a micro one-to-one level. And I think as I've learned the importance of research and how it influences clinical practice, I still get that buzz from being able to help people, but I've just had to reframe it in my mind how I would do that. It's less sort of hands-on with my patients, but now when I speak to patients and interview them about their experience of coming through the service and they're talking about things that I've been able to sort of advise and influence, I still get that satisfaction. But I think overall, whether you're a clinician or a researcher or a manager or whoever, I think we've all got a part to play to sort of help support people who access healthcare. But I know that not everyone wants to be a researcher. I do. I enjoyed being a clinician, but I think regardless of where you are, you can still make a big difference. I think what's now been recognised as the role of research in clinical practice, and I think what I've been able, what I'm really fortunate of being able to do is to be able to shape clinical practice over the last 10 years or so through the research I've been doing.
Oh wow, that's really lovely. Seems like you've really committed yourself into what you're doing and so passionate about it as well.
Yeah, well, I think I've been on a real journey the last. It's 10 years since I started, and it's starting off probably the sort of people that we're appealing to here, working as a clinician, being interested about things, wanting to change things, not because I was criticising what was going on, but being genuinely inquisitive about how we could do things differently. And then I look at where I am now, where I'm having a leading role in how we deliver and design and change services. It's all the same sort of stuff, but I think I've just been on a journey now where I'm in a position where I can make more changes than what I possibly was at the start. But there's definitely like a linear, stepwise process that's got me to where I am now. But I still feel as proud doing now as what I did when I was a clinician.
So can you tell me how those roles contribute to improving patient care or advancing healthcare practices? It's
not a one thing, and I almost need to reflect on where I was at a particular time. I mean, the research that I sort of was really interested in when I first properly got into research in 2015 was purely orientated when I would see patients who travelled from a long way to come to the Royal National Orthopaedic Hospital. I was sort of thinking actually it would be better if we could do it over Skype or over, I mean, now we've got Teams and attend anywhere and things like that. But it was around questioning how could we deliver our service differently that would then make patients' lives easier. And I ended up sort of doing a master's where I focused on that. I looked at the acceptability of consultations delivered virtually. I then went on to do a PhD. But I think at each step that I went through, I think where those roles particularly contributed was when I was probably quite an annoying person to have in a team. I was like, why can't we do it like this? Why can't we do it like that? And I hope I did it in a respectful way where I wasn't criticising, but someone that naturally questions why can be perceived as really annoying. And I'm sure I've irritated many people who worked with me, and that's just one of those things. But when you ask a question and then you do the work and then you answer it on a really small scale, then you almost get the credibility, and then you get the backing where you can go to that next level and do something bigger. So I'll do a master's project, get that published, do a PhD, several papers were published. Now I'm in a leading research role for a team where I'm designing services. So I think at each step I've taken through my career, where there's the opportunity to get involved with something and the opportunity to ask questions and the opportunity to learn about methods and then to deliver on that, that's just given me, I suppose, more credibility, and my CV's been better. It's enabled me to apply for research funding, to give me the opportunity to to then buy myself out of clinical practice, then do that work. I suppose it's just building and building and building. But it starts off just by, well, for me, it started off by asking a consultant anaesthetist why we do something a particular way. And she gave me an answer that I didn't really agree with. So then I went and did an audit project. And then I went to her and said, look, this is what I found. I disagree with you, but look, let's have a look at this together and let's see if we can work together to make service better. And then we wrote it up as a paper and got it published. But it's little things like that. It's being able to have respectful conversations where you're challenging practice or trying to understand why practice has been done in a certain way. But I think each day you come into work is an opportunity to ask questions. Again, respectfully, because there's nothing more annoying than just asking things for the sake of asking them. But when you're working with patients and you see things being done and you want to try and improve things, or you see something, I think having a respectful conversation and finding a champion to support you gives you the opportunity to sort of build and grow. And over the last sort of 10, 12 years, that's kind of what I've done, and taken each opportunity to try and make things better.
So would you say your open-mindedness, your question-minded, always questioning everything, sparked your interest into research?
Yeah, I think so. Yeah, don't get me wrong, there's a lot of stuff that we do really well and shouldn't change, in my opinion. But I think what's really lovely about working in, I mean, it could be any place, but particularly a place like this, is you can have conversations with people that are more experienced. You can pick their brains, you can have conversations, you can have debates, and that sort of gets my mind whirring about how things could be done differently. Someone told me really early on in my career that research is a really valuable currency within healthcare, and I think particularly somewhere like Stanmore Hospital, where it's very, as a physiotherapist by background, I think it's very sort of surgeon dominated here. But surgeons really value research, and what I found is if I went and had a conversation with a surgeon about something but then started talking about research, it wasn't they were more interested, but I think I was able to engage them a little bit better. And so doing research within this organisation and collaborating with surgeons, actually I think you need to sort of bring the people around you together. A single junior physiotherapist cannot change a pathway, but a single physiotherapist who engages the right people to support that, together you can change that pathway. And I think it's just those questions that sort of gets practice to advance potentially.
Have you ever been involved in a clinical research that was implemented in practice and you saw the changes that it gave into healthcare? Yeah, so I mean, yes, quite a few, and I suppose that's the thing that I'm most proud of, is when my research has been taken up by clinicians. I think probably the best example to talk about would be during my PhD research, which was on virtual consultations and happened to take place during the COVID-19 pandemic, when there were a lot of changes going on in the hospital. I was able to have conversations with sort of change managers within the trust, talking to them about the research that I'd done, and actually was informing and influencing some of the decision making, where we went from in-person consultations to virtual. And I was able to shape the way that it was implemented and delivered in a way that I feel better suited patients, recognising that not everybody wanted to have a virtual consultation. People really value hands-on care, as do the clinicians as well. So the pathways as they got implemented, I feel, were done in a way where we gave people the option to have different things, which is a pragmatic sort of solution to what was going on. But I know when we were having those decision-making conversations, I was able to talk about the interviews that I've done with patients, and that really sort of helped shape the delivery of the way that we rolled out virtual consultations. And also, as a researcher, recording that and writing about it and sort of presenting nationally, I had lots of conversations with people outside of the Royal National Orthopaedic Hospital and was able to talk to them about what we'd done. And I know that the work that we as a collective group at RNOH, the work that we did, actually shaped the way that other people delivered virtual consultations as well. So I'm not saying it was just myself, but I know that the work that I was doing had an impact on the way that the way that things ultimately went through here. So that was amazing to
the global pandemic wasn't amazing, obviously, but it was amazing to be able to shape the change that we put in based on research that had been conducted in the trust. And then the work that I'm doing now, I'm doing a lot of engagement with patients. We've set up some new musculoskeletal pathways in Enfield, and the engagement and the research that I've done with patients constantly evolves what it is that we're doing day after day, week after week. And even, as I said, that we went to a addiction centre today, it's because we recognise that those people that are accessing addiction centres are in a crisis point. They have got musculoskeletal problems, but they're not necessarily accessing care. So we're responding and evolving our service so that we can cater for people that need support, because we know that some people aren't going into primary care for their musculoskeletal problems. They're going straight to A&E. And what we're trying to do with the Musculoskeletal Hub in Enfield is to try and give people an easier route in so that they can have the care that they need, with clinicians from the Royal National Orthopaedic Hospital who are delivering care in the community. And that's the vision about bringing the expertise of tertiary care into communities. But my role, where I'm researching it, is helping to shape what it is that we're doing sort of in those pathways, and also influencing the way that other people elsewhere are supporting people who are underserved as well.
And as well, I can see what research does in healthcare, how it is impacting patients, making the healthcare system a bit accessible. Like you said, not everyone would like virtual, appointments. People like hands-on. Personally, I would like everything I have to do from home. Coming out is a problem for me, but saying that there are people out there looking into these things, people may not even see it as a problem, but to know that there's some people looking into these things, trying to figure out the way out, is really, inspiring as well. What are the things that enabled or facilitated your research career?
So I think I'm absolutely confident that I wouldn't be where I am if I didn't have the sort of people and the support from this organisation. So I was really, really lucky that I sort of came to RNOH and was at a stage in my career where I was interested in research. That sort of happened at the time where there was a lot of research infrastructure being put in place within therapies. So we had the sort of research lead within therapies, Angie Jaggi, was amazing. I mean, she was someone that I used to go to speak to, and she was a mentor when I talked to her about sort of my ideas and what it is that I wanted to do. But she was a research lead at the time, and she was very supportive of me going out to apply for funding to buy myself out to do my master's when I did a master's in research. I think she believed in me and what it is that I wanted to do, and she was a really strong advocate of I suppose my aspirations and my career journey. So it almost gave me, having the support of Andrew, and then at the time the clinical director of therapies, Rachel Dalton, they were really supportive and encouraging me to sort of apply for this funding. And then when I came back from completing my master's, it was at a time when a role had been created, and I was able to sort of apply for that and operate as a clinical researcher within the department. So I think having the support and having, I suppose, leaders within the department who had a vision for how research could be done, actually that was amazing timing for myself, because it meant that I had the support and the encouragement to be able to sort of follow my aspirations, but in a way where I was able to sort of come back to the department and consolidate my skills and apply them within a clinical context. And there just aren't many places where that existed at the time. I think it's becoming more commonplace now. But I suppose that ongoing encouragement and support, and even when I was sort of working clinically within our orthopaedic service, having a clinical manager that also welcomed me back in, is probably not the most ideal thing in the world for someone to be like doing a little bit of research, doing a little bit of clinical, and it took a bit of navigating, but actually having an understanding group of leaders. So Ros Moss was the clinical manager. So Ros, Andrew and Rachel creating an environment where I could do bits of both, and still develop my clinical skills, still develop my research skills, and then apply for sort of further funding. That was really important. So I think, the main thing is to have the infrastructure and the leadership in place that gives you those opportunities and gives you the headspace and the opportunity to be able to apply for these sorts of things. So I suppose that's one of the key things. I think finding yourself in a place where you've got forward-thinking leadership that have the ambition to support clinical research. Because there are many places where they don't have that, and that is why places don't necessarily have people like myself. And we've got a big team of researchers now within here, and we're really clinically active. And as a wider research group, what we can demonstrate is that although there's some money initially invested into therapies have now been able to generate that sort of grant funding, that revenue. So my PhD, I brought in nearly £300,000 that released me to do my research. I've now got a grant for £250,000 funded by NIHR. So I'm now able to go out and to apply for funding, which I've been successful with, that are then releasing me, so that they're not paying my full salary. I'm getting support from there, but it's kind of that initial investment and that vision has enabled myself and others to be able to sort of deliver on that and to really grow. And that's ultimately why I'm in a place where I can influence clinical care now as a postdoc researcher.
Wow, it's lovely to hear about the support researchers get, because the last two interviews we had, they said the same thing. It really shows that beyond the expertise, everyone needs support and a form of mentorship. And it's really lovely to know that the research community has that. So,
I just want to interrupt. I would say the research community within the NHS doesn't all have that. There are many places where they don't have that support. I think, you're speaking to people from this organisation, from the top, with Paul Fish as the chief executive. My current boss, John Doe, who's director of Allied Health, and many other people sort of throughout the trust. This trust is a really, I think, research aware and research active organisation, and I think really values research. And I think that's why people like me can thrive. If I was at another institution or organisation, potentially with different pressures, because I'll be honest, we don't have the same clinical pressures in a tertiary organisation that others do have. But I think it's not happened by accident. So if you're interviewing people from this organisation, I would expect for them to sort of recognise the support that we get, because we do get that support, and that's kind of why we are able to do what we do. But other organisations, I know because I mentor people nationally, I hear that they don't necessarily have the same infrastructure and support that we possibly do here. So sorry to interrupt. I just wanted to point that out.
Well, I know where to come to when I want to start my research now. Thank you.
Yeah.
This just seems like a very lovely place to start a research program. Thank you. So, how familiar are you with other clinical academic roles inside or outside of this trust?
Yes, I mean, inside this trust, particularly within therapies, I'm very aware, sort of having sort of come through the system. I think we're in a really fortunate place where we have got clinical academics sort of within the substantive staffing structure at this hospital. There are other clinical academics at other organisations as well, and I think they are becoming commonplace, which is great. I have many colleagues who have sort of been through a PhD and possibly have. I think it is a struggle. It's not easy, and it is a struggle to sort of get that PhD funding if that's what people are going for. But I think I've probably had more support than others. But you've got these amazing people who in other places are getting that funding and coming out the other side. There are roles now being developed to oversee and support non-medical research in other organisations, and I think they're fairly similar. And a lot of it is around facilitating a culture of research and having that support for other people to sort of grow and develop, whilst also these people are leading and delivering really high quality research of their own that is impacting clinical practice elsewhere. So I think across different organisations they all look quite differently, but I think there are more roles now that are in place aimed at supporting either getting research into practice or doing clinical research and then sharing and disseminating that more widely.
So do you guys collaborate with each other on projects?
Yeah, so I've got a network of people that it could be a a Tuesday evening Teams call over a glass of wine where you have a chat about stuff, or it could be meeting at conferences. I think now, as I'm becoming more of an established postdoctoral researcher, where I've got my own, I suppose, research area of interest, I'm getting more sort of emails from people that I know saying, "Oh, we're doing a project that's relevant to your area of interest. Would you like to get involved?" So I'm collaborating with a lot more people externally now, I suppose, as I'm being recognised, I suppose, as a bit of a leader in my area, or an emerging leader. I'm not leading stuff yet necessarily, but in the same way that if I was to be doing research, with someone on, I've got a colleague at the moment who's looking to do some research on back pain, and I've been able to signpost them to other researchers elsewhere for mentorship and support, and there are others who are interested in other things. So yeah, it kind of grows and develops, and what's really nice is being able to meet with like-minded people who've experienced the same things as me, going through PhD and postdoc and applying for postdoctoral funding now. It's great to be able to sort of bounce ideas off them and to share experiences and that sort of thing. And even now within Stanmore Hospital, we've got a PhD, someone who's doing a PhD at the moment that I can speak to and sort of mentor and support them in the same way that other people have sort of mentored and supported me. So it's a really big network and community. And I think you didn't see many clinical academics 10 years ago in clinical practice, and I think that now that's becoming a lot more commonplace, which I think is only a good thing, because you need to have those skills in clinical practice, I believe, to be able to support the knowledge generation and dissemination of knowledge, just to sort of uplift and to keep clinical practice as robust and high quality as possible.
Wow. So for those considering to join this clinical network, what steps should they take? Are there any specific qualification, skills or experience we need to focus on?
Yeah, I mean, I think in most places there are opportunities. I mean, there are some amazing networks out there. So, I mean, CAPA, the Council for Allied Health Professions Research, if you're an allied health profession, is a really great organisation where it's a signpost to different courses or journal clubs or funding opportunities. I think that's a really great thing. Within nursing itself, I don't know any nursing specific networks, but there's a really good health professions and research Facebook group which is targeting sort of early career researchers, where you can sort of have conversations with people and meet people. I think internally, if anyone is actually interested, I think it won't take too much to find who's research active or a research active clinician within an organisation. But if you're fortunate enough where you've got someone who's leading a project or a programme of research, there's something called the Associate PI scheme that is a training programme that enables you to learn how to conduct research within an organisation. But I think the first place I would signpost people to would be like the Research and Development Office. So we've got our Research and Innovation Centre here, but just to go and have a conversation with them about what's going on in the organisation and signpost internally to where it's going on. I've never turned anyone away who's less experienced than myself in research, who comes up to me and says, "I'm really interested to hear about what you're doing research-wise. Please, can we go for a coffee? Or can we have a catch-up at some time? Or can we have a Teams meeting?" I've never turned them down. And I think anyone who is involved in research would always be happy to speak to someone who is looking to learn. Myself, that there will always be opportunities. If someone wants to get some experience in being in a paper, there's always a systematic review going on where I need someone to sort of help and support me. So I think if you're willing to learn and willing to get that experience, I think you just need to take the initiative to have conversations with people. And if you really want to learn about it, there's plenty of people around that will share it. But there are those formal networks that are out there. But I also think the informal conversations internally is a great place to start too.
That's very insightful. Thank you, Anthony. So, what advice are you going to give to newly researchers, clinical researchers? Because I'm sure when you started, you faced some challenges as well. How did you overcome those challenges? And what advice will you give to people who just started clinical research?
Yeah, I mean, I think reflecting on it, it was, I think I had probably an easier journey than most, because instead I've got the support and the infrastructure here, and that was developing. And I think having someone say, yes, you can give it a go is really empowering. But it is really hard work. And I think now I'm in the position where my full-time job, I've got protected time to do research of interest to me, of importance to the patients that we serve. But when I was a full-time clinician with a young family, I've still got a young family, but younger than what it was then. There's a lot. There's no beating around the bush. You have to do stuff in your own time. If it's not in your job plan, no one is just going to suddenly give you time necessarily. I mean, some places might, but no one's going to give you time to just get on and do research. So there is an element of you have to, if it's not within your job plan, I believe that there is something where you have to probably go out of your way to do a little bit extra as you get started. And then when you've got that experience, or you've got that first paper, or you've got that first conference abstract, that gives you that little bit more credibility that then puts you in a place where you can apply for funding. I think, research, it is all about research funding to give you that time. If you want to be, and I'm talking about a clinical researcher leading my own program of research, but to get that time, you do need to put in a little bit extra. So I found it really quite difficult, just purely from the amount of work that I had to do on top of my job plan initially. And I was prepared for that, and I accepted that. But I think there is an element that you do need to put in the work. So it could be you going for an internship, okay? And that's great. But to do that application, you might just need to do a little bit in the weekends or in your own time. But then when you get that internship, and then you come back to practice, you've got that protected time, you've got that infrastructure, you've got that network, you've almost earned it. I think they're not easy to get, and if everyone went for it, not everyone will be able to get it. So it's just thinking about what can you do yourself just to put yourself that little bit further ahead of the field. And I think it just takes the initiative to get up and going at the start. And that's a constant thing throughout. When I was doing my PhD application, that was weeks and weeks and weeks and weekends of just evenings gone doing that. And then, the higher you get, actually, the busier you are. So I think it's not just going to come and land on your lap. It's a great career, and it's absolutely fantastic, and I love it. And it's every day. I'm really thankful that I get the opportunity to do that. So I can look back and think it was absolutely worth it. But I wouldn't be where I am now if I hadn't sort of put that initial work in at the start. If that makes sense.
Yeah. Well, thank you so much for that. So before we round up, is there any final words? Because this podcast is to encourage those who want to get into career, make people aware of, clinical research or clinical academic research. Is there any final word do you want to tell us, like summarize everything you do as a clinical researcher?
And I think, and people ask me what I do for a job, and I say I'm a research physician, and they're like, oh, what's that? And it's really difficult just to pin it down to what it is. But I think when I take a step back and look at it, I am a physio by background, and I'm proud to I still call myself a physio. I still feel I don't wear a tunic and treat people in a cubicle, but I still feel very much clinical because I'm in a clinical team and I'm treating patients. But I think whether you're interested or not. If the idea of reading a paper fills you with dread, that's fine. It's okay. I mean, it's not fine because we do need to know the evidence, but there are other ways around to keep on top of that. But I just think if you are interested and if it's intriguing, then do explore it, because it could be that you try it and then you don't like it, and that's equally okay. But I think if you've got that inkling, I would encourage anyone to sort of follow those thoughts. And I think nowadays there is a lot more support and infrastructure out there, but you just need to use your initiative to go out and find it. I think most places now it is available, and we've got internships. We've got people that are leading internships. It may be that you apply for an internship and you don't get it. Well, then drop them an email and say, hey, can I have some feedback, or can we have a conversation, or what do I need to do? In most NHS organisations now, there are people who are doing it, and I think when you can see those people that are in those roles, I think just reach out to them. It feels scary, but I don't think there's anyone that would say no to having someone reach out to them and ask for a conversation. So it's just about taking that initiative at the start and then seeing where it goes. But I very much had my career mapped out and planned. I thought I was going to be doing this, that and the next thing, and now I'm a lot more chilled out about it, because it's not a linear path and it's not a linear journey, and there is something about following opportunities that present themselves and being flexible and actually being okay with not knowing where the end destination is. And I think because I've been quite chilled out about it, I definitely wasn't initially, but because over time I've learned to not overthink where I'm going to end up, I think I'm just on this really lovely journey now that is, I don't know where it'll end up, but I'm just enjoying it whilst it's happening. So I think, if you can get onto that pathway, it's great. So just do what you can to set yourself ahead of everyone else, and then the opportunities will come.
Thank you so much, Anthony. Well, hearing from the wonderful things you have to do, it seems like you have a lot on your plate, but you love doing it. So thank you for having the time to join us here and giving us this insightful information. Also, thank you to Royal National Orthopedic Hospital for the opportunity to record this podcast. I know, speak to lovely people like you. We have this podcast. It's new, but we have episode coming up, and to our listeners out there, we want you to tune in for the next episode. We'll be discussing about research nurses and practitioners, understanding their roles inside delivery of research team. Thank you for listening to the Insights Out London Research Podcast. Don't forget to subscribe and stay tuned for more inspiring stories from healthcare and research professionals.